Welcome back to Meds Made Easy. My name is Tarun. Today we're going to be talking about Esketamine, also known as Spravato. This one was a viewer request. They really wanted to know about this one, and I heard you, I got you, and this one's for you. So it is for treatment-resistant depression. So depression has, I think, like 20 to 30 medications possibly that you could take for depression. It's a massive field. There's a lot of medications there, but if you respond to literally none of it, we've tried all different mechanisms of action, and it doesn't work, then you come to Esketamine. It's a nasal spray, that's how you take it. It usually comes in a thing that has 2 sprays in it, one for each nostril, and it is an NMDA receptor antagonist. Now here's the weird part. They don't know exactly by which mechanism that this elicits the effect that it does, but they know that it's a metabolite, meaning that once Esketamine gets broken down into your body into smaller pieces, those pieces have an effect on treatment-resistant depression. Now, it peaks in about 20 to 40 minutes. The primary esketamine molecule, that one has a half-life of about 7 to 12 hours. So half-life meaning half the drug is out of your body in about 7 to 12 hours. Now, those smaller pieces, once it gets digested, technically, that's another 8 hours. So it is a long-acting medication. And that's kind of what it does, because we've noticed that the metabolite swirls around in your blood a lot longer, and that elicits that effect. It does have a black box warning, heavy sedation, meaning extreme fatigue, sleepiness. There is a potential for abuse and misuse. And then, of course, there's a black box warning for suicidal thoughts, but the suicidal thoughts that's a black box warning for anything, for any antidepressant, essentially. So you always have to kind of watch out for that. If you're pregnant, you really have to weigh the risks and benefits, but generally, I think you do see issues with this in pregnancy. So it's a very rare situation that you would ever be on this medication and be pregnant. If you're lactating, you do not take this medication. It gets through into the baby, and you don't want that. Generally, unless you have severe liver issues, you don't need to worry about this drug. And if you have severe liver issues, you have to watch out for this medication. Renal issues, I don't think that there's any issues if you have any sort of compromised renal system. Tidbits to know with this medication: to reduce nausea and vomiting, you have to avoid food 2 hours before you take this medication, and 30 minutes if it's liquids. So just keep that in mind. Now, usually I know you're supposed to take food to help you keep it down, but because this is a nasal spray, it kind of works a little bit differently. So you don't want to have food in your system. You don't want to take it with it. Let's see here. If you use any other nasal spray like Flonase, allergies, whatever, you have to space it out an hour away. So try to take your nasal sprays, your decongestants and things like that, an hour before you need to take Esketamine. You don't need to prime it, because if you prime it, you're just losing medication. So priming means that when you first get the bottle, you give it a couple of sprays and get the medicine working through the pipage, right? You don't need to do that with this one. This one comes ready to go. We don't want you to waste medications, because each little spray bottle is just one, and then that's it, usually. Each nasal spray, so one bottle with 2 sprays is 28 milligrams. Oh, I can't remember. Whichever it is, it's 28 at the moment. So if you're on more than that, if you're on the 56, etc., then you need multiple bottles that you use for this, okay? Guys, I think that is it. If you have any concerns, questions, please leave them below. Let us know how we're doing, hit subscribe, and we'll see you next time on Meds Made Easy. Bye.